My side.
Yeah.
Yeah, smaller. Flip. All right. Good. Just relax. So you already see, right? He's laying, legs kind of in external rotation. His knee isn't even touching the table. Okay, so already I'm kind of happy. Right? This tends to appear. Yeah. Okay. This is better. Right? That's his external rotation. Maybe 15. His internal actually has more internal than external. But okay. So we're going to traction his hip, and use this towel. So generally, I'll put a towel just for padding. And again, when you use the belt, I was always taught that when you use the belt, you want to have it set up so that to adjust it, you're pulling the belt away from you as opposed to pulling this way. So I just slide it down with guys. You just want to make sure that all the equipment's out of the way. So, okay. And so then what we're going to do is we're going to set ourselves up to just feel. So I'm just going to take him, right, and traction him this way. Any symptoms there? No. Just pressure?
Yeah.
Yeah. Okay. So, and then I can change. So this feels less movement than this. So this is in the treatment plane here. So then I'm just here, and I'm just weight shifting back. So if I do, so I'm at grade 4 range right now. So if I'm going to do an oscillatory grade 4, it's going to look like this. Okay, so you really shouldn't see much movement there, right? It's not this. Okay, that's going from no resistance to end of resistance. So I'm going to just come in, and again, because he has a tight hip, then I can do just a sustained, and again, if I wanted to, I can do just a little oscillatory movement. And so as I'm doing this with the patient, I'm just explaining what I'm doing. You know, because once you grab a belt and start strapping their leg to your body, they kind of wonder what's up. Okay? So, you know, I just tell them to say, you know, the ligaments around your hip are tight, and so we're just doing this to three-dimensionally stretch your hip. Usually patients who have weight-bearing sensitivity through their hip, they will love this position because you're de-weighting their joint surface, and they can often you'll feel them just relax. So a lot of times when patients have global muscular tightness around their hip, it's because their hip is painful and it's limited with capsular restriction. So you can oscillate or you can do sustained, and a lot of times you'll feel initial resistance and then it lets go a little bit. So, so we can do this. So again, the whole time I'm just feeling. Now again, if I did a sustained pressure, then it's hard to know when I'm done. But if I then do the little oscillation and say, okay, that grade of oscillation feels like it's better than when we started. Okay, so we're just going to do just a little bit more of this. And yeah.
In the practical, you guys, it happens all the time, and I guess this is the thing that really bugs me, is somebody like him, he's so tight, right? We know he's tight, and he needs, and you're mobilizing because you want to gain range, and then you tell us that you're doing a grade 3. Why? It doesn't make sense. I mean, it just doesn't make sense. You're going through all this, you're strapping him in, you're strapping yourself in, you're working this hard, and you're going to do a grade 3? We're trying to get motion, right? We need to get motion.